Alright, hi guys, welcome to Movement. We're going to talk about low back pain. And why we're talking about low back pain is because low back pain is so prevalent today. 80% of Americans will experience low back pain in their lifetime, and 1 out of 2 working Americans experience low back pain each year. So as you can see here, we have 4 different categories that show what kind of low back pain most people are having. We have disc low back pain, radiating low back pain, which is like sciatica or pain traveling down the leg. We have low back pain with mobility, and we have low back pain that's related to movement coordination deficits and power deficits. And right now I'm going to pass it over to Clayton to talk about nerve pain.
So one of the big things in this category is we'll touch on the radiating pain. It's kind of more prevalent, but real briefly we'll talk about if it is a true disc pain. The reason why I won't spend a ton of time here is it's not very common. Typically in a clinic you'll see 1 to 2 disc patients in terms of how they respond. But essentially if you have pain that is coming down your leg, and when you do either a movement where you come forward or typically when you bend back, that pain decreases and comes more centralized or to your back, then you'd fit under this category. And what you'd want to do for that is probably just keep continuing to extend and progress to the movement category as quick as you can. With radiating pain though, the big thing is what's causing your pain, and that's nerve. If you have pain in your back that's traveling down your leg, as Jeremy talked about, then you're in this category. And really what we'd like to do there is we need to desensitize that nerve. And how we do that is we get your body and your nerve used to movement. And so we'll talk about techniques in terms of different kind of stretches essentially, in terms of where you oscillate this movement, and that nerve will be kind of put on stretch and get used to this movement so that you can get into this main category.
Alright, and so with these categories, with mobility, basically if you go to a PT clinic and if you see any of us working and we put you in this category, it's most likely going to be an intervention that would target the location of the pain and give a little bit of some mobilization around the area. So for home, it would be something that would look like a lacrosse ball on a painful site, or maybe even foam rolling. We won't dive in too deep with this because this is where we get the bang for your buck right here. Because in this category, usually it's because people are not moving the way they should be moving, which is causing them pain. And we could talk about different movement patterns such as sitting, picking up stuff from the ground, maybe even something in your workout that you're doing wrong that's causing that pain. We're not going to talk about mostly about what the coach's eye or the physical therapist should see and correct. We're going to talk about mostly the main interventions that can help you move better, such as flexibility exercises as the hip flexors, or even glute activation activity to prevent you from using other muscle groups that can cause pain. Alright, now just to recap of what we said about those 4 categories, we're going to mainly focus on these 2 categories right here, radiating pain and movement. We're going to talk about location, and we're going to talk about pain behavior. So the location of the pain and the behavior. And so what this does for radiating pain is if the location is radiating throughout the leg, common things like piriformis syndrome or sciatica, those are not localized and more peripheralized, meaning outside of the low back. And the pain behavior, if it's a constant pain, that's something that you would be looking at and would categorize yourself around this category of low back pain. Now, if your pain behavior and your pain location is more localized, you're probably seeing yourself in the movement coordination. If it's something that the pain comes on with prolonged activities, such as picking up something off the floor, or maybe even washing dishes, or doing lifts such as squatting or Olympic lifts or powerlifting, you would probably find yourself in the movement category. And so we're going to dive in deeper into these 2 categories of interventions that would best help the pain population of low back pain in radiating pain and with movement coordination.